Hello, thank you for joining us for today's presentation on cervical cancer, What You Need to Know. This is in honor of Cervical Health Awareness Month. My name is Gina Ora, and I'm the Physician Liaison at McLaren Bay Region. During today's broadcast, as questions come up, please feel free to comment and they will be addressed at the end of the presentation. Today, I have the honor of introducing Dr. Itauma, obstetrician gynecologist with Great Lakes Bay Women's Care.
Thank you, Gina. And thank you everyone for joining this presentation. I will be talking about your cervical health. Do you know what causes cervical cancer? I will be talking about this during this presentation. During this talk, I will cover cervical cancer, risk factors, how to prevent cervical cancer, symptoms, diagnosis, and treatment. What is cervical cancer? Cervical cancer happens when you do have cancer cells on the cervix. Now, we do have a condition called cervical dysplasia, which occurs when you do have precancer cells on the cervix, which, if left untreated, can progress to cervical cancer. Cervical cancer is the third most common female reproductive cancer in the United States right now. And it's been found that the human papillomavirus, called HPV, has been shown to cause majority of cervical cancers. In fact, it's been found in up to 99.7% of cervical cancers. What puts you at risk of HPV infection? HPV is usually acquired through sexual activity and has been shown to be the most common sexually transmitted infection in the United States. However, 90% of HPV infections clear within 2 years without causing problems. What other risk factors are there for cervical cancer? Having a weakened immune system, such as occurs in conditions like HIV, tobacco smoking, which weakens your immune system and weakens the ability to clear HPV, not having access to health care and cervical cancer screening, certain contraceptive methods, if used for greater than 5 years, actually the birth control pills, if used for greater than 5 years, can increase your risk of cervical cancer. However, this risk decreases as soon as the pills are stopped. A strong family history of cervical cancer may increase your risk, and this is because of certain genetic susceptibilities that are being studied. How does one prevent cervical cancer? First thing, regular screening. You should have your annual GYN exams with your primary care physician or OBGYN. And you should have your pap smears regularly as scheduled. In the United States, it's recommended starting at age 21 up to age 65, every 3 to 5 years, depending on the components that are being screened. And this would be in females that have no symptoms with previously normal results and with normal immune function. For people with immune compromised states or with previous abnormal pap smears, the screening schedule would be different. Please discuss with your OBGYN regarding your pap smear screening schedule. I would like to add that, again, an annual GYN exam is very important regardless of the schedule for your pap smear screening. The pap smear is a component of the annual GYN exam, but is not the only thing that's covered during your annual GYN exam. How else can one prevent cervical cancer? HPV vaccination. We've seen that HPV is the cause of almost all cases of cervical cancer, and now we have a vaccine to prevent HPV infection. The CDC recommends starting at age 11 or 12 through age 26 for males and females as regards HPV vaccination. However, it can be started as early as 9 years, and one can also be vaccinated through age 45 if you did not get it during that between the ages 11 to 26. It's also been recommended because it's been shown that women who've had previous abnormal pap smears and who've had surgical treatment for these pap smears can still benefit from the HPV vaccine because it decreases the likelihood of having recurrent or further abnormal pap smears. Now, moving on to symptoms. What are the symptoms of cervical cancer? The thing is, cervical cancer can happen frequently without symptoms. And that is why screening is important. By the time one usually develops symptoms, the disease may already be more advanced. In any case, what symptoms can occur with cervical cancer? We can have irregular or heavy vaginal bleeding, bleeding after intercourse, vaginal discharge, pelvic or low back pain. This may happen actually with more advanced disease, or bowel or urinary difficulties, again in advanced disease. Moving on to the diagnosis. How do we diagnose this abnormal cells or cervical cancer? A physical examination by your doctor, pap smear, a special procedure we call colposcopy, where we take a closer look at your cervix, as well as cervical biopsy, where a sample is taken from the cervix to examine for any abnormal cells or cancerous cells. If cervical dysplasia is diagnosed, again, I mentioned the cervical dysplasia is that condition where you have precancerous cells on the cervix. If this is diagnosed, the treatment will depend on the staging, on the grade. If it's mild, it may be observed because sometimes the cells can regress to normal. If moderate or severe, a surgical excision is usually recommended. If cervical cancer is diagnosed, again, this would depend on the stage at diagnosis. It can be treated with surgery, chemotherapy, or radiation. However, that will be determined by the GYN oncologist. All right. So we talked a lot about cervical cancer. We talked about risk factors, prevention, symptoms, diagnosis, treatment. Now, what would I like you to take home from all of this? Number one, cervical health is important. Please see your primary care physician or OBGYN every year for preventative gynecological exam. Have your pap smears regularly as recommended. Your lifestyle should support a healthy immune system. Get vaccinated against HPV if eligible. Thank you. Any questions?
That is so much great information, Dr. Itauma. We have a number of questions that have been submitted. First off, from Amy, if someone has history of ovarian cancer in their family, do they have a higher risk for cervical cancer?
Thank you, Amy. That's a great question. The cause of cervical cancer is different from that of ovarian cancer. So I would say that at this time, from the scientific knowledge that we have, the ovarian cancer is not related to cervical cancer. So the risk factors are different.
Okay, great. The next one is from Elena. And if I'm diagnosed with cervical cancer, What are the next steps? Is it likely to reoccur after treatment?
Again, great question. The treatment for cervical cancer depends on the stage at when it was diagnosed. So I would say that the decision for treatment and the mode of treatment would be determined by the GYN oncologist. So I'll leave it to the decision of the GYN oncologist, which is a further specialized field, specializing in the treatment of female reproductive cancers.
Okay. So she did have a second part. Is it more likely that if you've had treatment that you will have a reoccurrence of cancer?
Well, usually after treatment, there's a surveillance period. It is possible that it may recur, but again, the surveillance plan will be determined by your GYN oncologist.
I understand. Okay, so that looks like it's all the time we have today. We can't thank you enough for sharing your time and knowledge with us, Dr. Itauma. For information on upcoming programs and health screenings, you can log on to www.mclaren.org/Bay Region and check out the upcoming events. Thank you again for joining us today, and stay healthy and safe.